She loved nursing. She was like most of us our age, trying to get ready to, I guess, retire.
When Steve Cicala's wife Susan developed a cough and worsening fever last March, he drove her to the emergency room at Clara Moss Medical Center in New Jersey, where Susan had worked for years as a nurse.
They admitted her, and her breathing got worse, and uh, her blood pressure and many other things started to deteriorate until they needed to admit her to the intensive care unit.
Susan had contracted COVID-19. As her breathing and blood pressure deteriorated, she was given azithromycin and hydroxychloroquine and put on a ventilator. 11 days after being admitted, she went into cardiac arrest and died at the age of 60.
By the time we got to the hospital, she had already been pronounced, and we had never gotten to see her.
Cicala is now the first person to be pursuing a COVID-19 claim with a U.S. government fund called the Countermeasure Injury Compensation Program, or CICP. Set up a decade ago, the fund has up to $30 billion that can be used to compensate for serious injuries or deaths caused by treatments or vaccines in the fight against the pandemic. And COVID-19 presents the first serious test of the program, overseen by the Department of Health and Human Services. It has in the past denied compensation in 90% of the cases filed prior to the pandemic, mostly for H1N1 flu vaccines.
There's nothing that's going to bring her back. But obviously, with our two children and now two grandchildren, if there's something that we could do to help them out, you know, that would be nice and helpful. But nothing's gonna bring her back, and we know that.
While he is not alleging negligence against the hospital, Cicala could receive around $367,000 from the virtually untapped fund if he can show the treatment caused his wife's death. Cicala's lawyer Jonathan Levitt said the electrocardiogram records show Susan Cicala's heart rhythms were disrupted by hydroxychloroquine and azithromycin.
So those two in combination are known to be deadly now. And unfortunately, that's what she did have. And she was also placed on a ventilator, which, as you know, also has some substantial dangers.
Levitt said he has more than 200 clients planning to seek compensation for deaths allegedly caused by failed COVID-19 treatments. He said most of the cases are related to the anti-malaria drug hydroxychloroquine.